Before labour starts, the cervix is long, firm and closed. During the latent phase, the muscles of the uterus or womb contract and make the cervix shorter, thinner and softer. This is often achieved with irregular contractions or tightenings, which may or may not be deemed painful. The cervix also moves forward to an anterior position and starts to dilate or open gradually. This process can last a few hours or up to a few days, although it can be shorter for second or subsequent babies. Lower backache or period-like cramping sensations. Sometimes contractions start for a few hours and stop for a few days. Some women may not even be aware of these contractions. You may or may not pass a show, a mucousy plug from the cervix. The show can vary in amount and colour. It can be a yellowy clear mucus, or sometimes it can be streaked with blood and appear pink or red. If the blood loss is more than a streak, or you are concerned about the amount, you should contact your midwife or hospital for advice immediately. Some women experience their waters breaking. This is also called a spontaneous rupture of membranes. This is a leakage of the amniotic fluid which surrounds your baby once the protective sac has burst. You should call the hospital for advice when this happens. Midwives will need to see you to review the colour of your waters. They may be clear, yellow, pink, blood-stained, or sometimes green, and to plan on ongoing care. If you think they are blood-stained or green, call the hospital immediately. Sometimes, once the waters break, no contractions begin. In this instance, if all appears well, we will give you an appointment approximately 24 hours after they broke to return to the hospital to start your labour contractions in order to reduce the risk of infection. We recommend you stay at home as long as possible. Research shows the further along in labour you attend the hospital, the more likely you are to have a normal birth. To help with this, you can try a warm bath or shower, which can be relaxing and help with backache or period pains, a painkiller like paracetamol, taken as recommended on the packet instructions, listening to music or watching TV for distraction, taking a walk, apply a TENS machine, a transcutaneous electrical nerve stimulation machine. These can be hired or purchased. Just remember to remove it before entering a bath, shower or pool. Practice relaxation techniques. Try massage. Your birth partner can do this for you, especially focusing on your back. You may find that it helps to make love. Kissing, cuddling and intimate contact encourages your body to produce oxytocin, which is a hormone produced in labour, and it makes your uterus contract. Complementary therapies may be very beneficial at this time, such as reflexology and aromatherapy by trained professionals. Eat little and often to maintain energy levels throughout labour. Keep well hydrated, remember to rest adequately, and monitor your baby's movements and call the labour ward if you feel the pattern of movements has changed. Remember to call the hospital if you have any concerns or when you think you're in labour, and a midwife will advise you further.